Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. World No Tobacco Day is coming up at the end of May. While cigarette use has gone down dramatically in the U.S., many still die from smoking-related deaths here and around the globe. Stephanie Desmon talks with Tuo-Yen Tseng and Kevin Welding from the Institute for Global Tobacco Control at Johns Hopkins about the trends in tobacco and nicotine marketing, from packaging that looks like a cup of soda to e-cigarettes that link to video games, things that continue to worry experts. Let's listen.
Kevin Welding and Tuo-Yen Tseng, thanks so much for joining us.
Thanks for having us.
Yeah, thank you.
Today, we're going to talk about World No Tobacco Day. And before I start talking about it, Kevin, why don't you tell us a little bit about what it is and why we have it and what the theme is this year?
Sure. World No Tobacco Day, we've had it since actually like the late 80s. The World Health Organization started it. The purpose was really to inform the public of the dangers of using tobacco, exposing some of the tobacco industry tactics, and also highlighting any progress there was in protecting health. Because, we know there's a lot of good research around tobacco control, and we know research saves lives. So every year they have a different theme, and the last few have talked about the environment, farming, protecting children. The theme this year is Unmasking the Appeal. The tagline is Bright Products, Dark Intentions. And that alludes to the tobacco industry's use of making products really appealing, bright, flashy packaging and products. I think the reason why, you got to think the late 80s, this is when the US was starting to smoke less. They were still smoking a decent amount. The rest of the world was really ramping up in their consumption of cigarettes. I think sometimes tobacco control is a victim of its own success in the US. It's been a success story here. And a lot of people think, we know about tobacco. We don't need to deal with tobacco anymore. But we know that without continued surveillance, continued research, the tobacco industry just fills that void and they try to roll back policies. So this is an annual reminder that this is still going on. It's also to denormalize this practice. This is not a normal product. It's probably not a product that should have ever existed. So it's really good to think about that. We've done a lot of things to denormalize it. The Surgeon General's reports, we used to be able to smoke on planes. I still can think about these old photos in Madison Square Garden of these things that they look so, has this nice haze. And it's literally smoke in the arenas that it used to be so normal. So yeah, it's not an everyday product. All this death and disease is preventable. And I think it's a really personal thing. Everyone probably knows someone who has been impacted by smoking, whether it's a disease or a death. And it's really soul crushing that this is completely avoidable.
So Tuo-Yen, talk to me about sort of what manufacturers do to make these products more appealing to young folks in general.
Yes. So when we think about tobacco, we often think of cigarettes, but today there's a wide range of nicotine and tobacco products on the market. That includes e-cigarettes, heated tobacco products, and nicotine pouches, all designed to appeal especially to young people. These products use a variety of tactics to attract users, like bright, flashing packaging, sweet or minty flavors, sleek device designs, and designs that resemble snacks, toys, or tech gadgets, and youth-oriented marketing on social media.
What are you seeing sort of in terms of research, Tuo-Yen, in terms of e-cigarette marketing trends?
Yes, so we're seeing that some e-cigarettes packages are really taking the packaging design to this level that they use not just colorful packs, but that we've also seen products that look just like snacks. It could look like a food item or a drink. For example, we've seen this pack that looks exactly like a strawberry cake box. And there's a soda cup. If you don't look at the description, it looks exactly like just a cup of soda, and you can't even tell that it's e-cigarettes. So these designs really attract young people and can lead them to underestimate the harms of these products.
Kevin, how can this type of marketing be stopped? Is it different based on the country?
I mean, actually, we have a pretty good universal guidebook. Like, we know what works. So the World Health Organization has the framework for tobacco control, the first public health treaty. And this gives you policy guidelines. And they also have the Empower measures, which literally tells you sort of what things you should do to look at stuff. And we sort of know, I think, what works and what doesn't work, or what countries are doing well and what they could do better. So a lot of countries universally, they're doing pretty well in packaging and putting health warnings on packaging. They're doing pretty well at increasing the amount of plain packaging, which means there's no branding on this pack at all. It doesn't, we often say that a cigarette pack is like a little billboard. And like, you don't want to allow the industry to really use that billboard to be very attractive. They're also doing really well on making tobacco and nicotine-free public spaces. They're doing well in banning advertising, promotion, and sponsorships. Places where there are opportunities that we know would help are banning flavors, regulating product design, like making a lot of these products, cigarettes particularly, and the other products, less addictive, reducing the amount of nicotine in these products, and also increasing the taxes. We have had some research where we've done packaging experiments on quit intentions, and we see larger health warning labels, higher prices lead to more quit intentions.
Mm-hmm. Are there any regulations on the type of thing that Tuo-Yen was talking about?
In terms of what exactly, like the way packaging looks?
Yeah, I mean, these crazy packaging she was talking about. The strawberry cake.
I mean, when we talk about plain packaging, we also talk about plain and standard packaging. So there is policies that can standardize what the package should look like. And a lot of what they're doing right now is not with the best intentions. Like, if you look at the product, you would not know what it is. Like, I look at this product and I say, that is a 7-Up. Like, that is a piece of cake. So even if they're allowed to do this, they shouldn't be doing this. It looks extremely attractive to especially young consumers.
Mm-hmm. Mm-hmm. Tuo-Yen, you've talked to youth focus groups. Tell me what they've told you.
Yes, so I wanted to say that beyond packaging, there's so much that tobacco companies are doing to hook kids. So kids we've talked to in our research told us that they love the delicious flavors of e-cigarettes. Instead of chewing gum after a meal, they will vape to clear up the aftertaste. They also said that the vapor from the e-cigarette smells so good that they can wear them like a perfume. What's especially concerning is that flavors can make these products seem less harmful. For example, kids say even though the nicotine content labeled on a product is quite high, the flavor coconut melon sounds so soft, it can't be that harmful, right? So these are all the very concerning things that we're seeing in these products.
And what are sort of the current figures when it comes to smoking? I know that, for example, as you said earlier, smoking rates are down in the United States, for example, but I understand they're still rising in other places.
So you're absolutely right. Even though we've seen some trends going down, which shows that all the efforts we're making are working, which is very rewarding to learn. Tobacco use is still way too high. Tobacco remains the number one leading cause of preventable death, both in the US and around the world. Every year, tobacco kills almost 500,000 people in the US and 8 million people globally. Today, about 1 in 5 adults worldwide use tobacco. That is 1.25 billion people in the world. So we're talking about 8 million of lives that could have been saved every year. That is still way too high.
And like we mentioned, it's decreased a lot in the US, right? In 50s, 60s, it was in the 40% range, and we've gotten it pretty close to the single digits. But at the same time, the companies have essentially like exported this product and all the health harms associated with it to low and middle income countries. And yeah, so it does look very different than the United States and other places.
Mm-hmm. So what do you see looking forward, Kevin? I mean, how can we combat these marketing techniques that are causing so much trouble?
The biggest challenge is the tobacco industry itself, right? Tobacco industry interference is the thing that stops us from making progress. You know, there's that famous line that mosquitoes don't have lobbyists. Like, the tobacco industry has a lot of lobbyists. They spend a lot of money to lobby governments. They spend a lot of money to advertise their products. And they spend a lot of time trying to block any tobacco control policy that is trying to save lives. Like, we know this product is not a normal product. Like I said, it's not a product that's easy to consume either. A lot of these products need the flavors that are in them to make them palatable. People don't like using the products unless the industry actually sort of innovates to make them more appealing.
And sort of what's the end game here? Sort of what are you hoping we'll see in the coming years?
I mean, I think, again, we know what works, and there is some hope, right? That there's a ton of great researchers supporting this area. There's a ton of passionate advocates, and there are strong public officials. We know that the products are often targeted to children. And actually, we see children as one of the sort of more promising and hopeful components of tobacco control. Every year, one of our partners, the Campaign for Tobacco-Free Kids, has this big youth advocate focused gala that I often attend. And, you know, it celebrates them, and it's an invigorating and inspiring event. And it really instills hope for the future. Like, these individuals, they don't love the corporate influence that is in their lives. So the next generations, I think, will push back even further. But there are initiatives that are trying to really target the end to this epidemic. There's Project Sunset, which phases out tobacco for younger generations. So someone who could never have aged into having it in their life, they'll never be able to purchase it. There are flavor bans at local levels like Massachusetts. There's even smoke-free spaces in a place like Beijing where the tobacco company and the government are very intertwined. And we've seen innovations like Canada. They've put their health warning labels on the stick filter as well as on their packaging.
Of course, my daughter still complains that there's vaping in the high school bathroom. You know, it's still getting new users.
Potentially. I will say it's better than having smoking in the bathroom. Like, we still think we can't take our eyes off of cigarettes, but we do know that we have to be very aware of e-cigarettes, heated tobacco products, nicotine pouches, because they all are potentially a pathway to smoking, which we know causes most of the lung cancers and a lot of the death and disease that we see from these products.
Tuo-Yen, what can listeners do?
Yes, that's a great question. So like Kevin said, we know there are policies that work. So we would encourage everyone to support these policies, and to learn more how to do that and other information, you can visit our website at globaltobaccocontrol.org/World No Tobacco Day. And I wanted to add that we know there are effective treatments for people who want to quit smoking or vaping. There are ways to get help. So if you or someone you know wants to quit, you can call the free quit line. In the US, it's 1-800-QUIT-NOW.
And in terms of research, Tuo-Yen, what's your next question that you'd like to answer?
So I already described like so many things that we're seeing. I also wanted to mention it's not just the design of the packagings, it's also the products themselves. We've also heard from kids in our research that they love the e-cigarettes with sleek, compact designs that come with lanyards so that they can wear them as a necklace and plan their outfit around it as part of their fashion. And it makes them look cool and gives them something to show off to friends. There are also some e-cigarettes, and this is like a rising trend, that are made to look like, for example, Apple Watches and e-cigarettes that have touch screens and built-in video games. And all these features that you can imagine are particularly attractive to young people. So really, the tobacco companies are constantly coming up with new ideas and new designs to attract people, and they tap on the new trends. For example, these like technology, they call these new products that allow video games and connections, even with smartphones. They call these products smart vape. So I would be really interested to learning about these new trends, new creations, but also being proactive in predicting tobacco companies' actions and not wait to respond, but really react to it, like be ahead of the steps to prevent all these new actions.
Tuo-Yen Tseng, Kevin Welding, thanks so much for joining me.
Thanks for having us.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.